Hello and good afternoon. My name is Zulima Chavez, and I'm the Support Center Manager for the Asthma and Allergy Foundation of America, or AAFA. This episode is produced independently by AAFA with support provided under a cooperative agreement with the U.S. Centers for Disease Control and Prevention, National Center for Environmental Health. The content of today's episode does not necessarily represent the official views of the CDC. Today, we're talking about asthma during pregnancy with Dr. Jennifer Namazy, who is an allergist immunologist at Scripps Clinic in San Diego, California, chair for the Women's Allergy and Immunology Committee for the American Academy of Allergy, Asthma, and Immunology, also known as QuadAI, and represents the QuadAI for vaccines and medications in pregnancy surveillance system. Welcome and thank you for joining us on today's episode, Dr. Namazy.
Thank you for having me.
Of course. Pregnancy can be an exciting time for parents to be. Asthma is one of the most common medical concerns during pregnancy. During this time, patients can experience changes in their asthma. Dr. Namazy, can you talk more about this?
Absolutely. This is such an important part of respiratory health, and you are exactly correct that it is one of the most common conditions to affect pregnancy. In the United States, there's an incidence about 8% of pregnant patients that have asthma. So it's really important to kind of learn more about how we can better manage it and treat asthma during pregnancy. You're exactly right. The course of asthma can change during the months of pregnancy, and about 40% of pregnant patients actually have their asthma worsen. So it becomes extremely important to really understand how we can improve these numbers. We know that there's a 20% exacerbation rate in asthma as well, and so this really becomes a critical time. Because we do know that affecting the control of asthma can really affect outcomes as well.
What are some asthma symptoms that can happen during pregnancy?
The symptoms are really not very different than the non-pregnant asthmatic. So the classic symptoms of worsening control of asthma could be more shortness of breath symptoms, chest tightness, cough, symptoms of shortness of breath or cough or wheezing that can wake you up from sleep. These are all common symptoms in pregnant as well as non-pregnant asthmatics, especially when the control of asthma is worsening. But I think it's important to also keep in mind that about 2/3 of pregnant patients have symptoms of respiratory symptoms that can occur during pregnancy, such as shortness of breath or chest tightness. And this can be a result of the differences in respiratory physiology that happen with pregnancy. And so it becomes very important to be able to delineate these symptoms from worsening asthma. And that's where seeing an asthma professional, whether they be an allergist, immunologist, or a pulmonologist, that can use specific testing that can really help identify whether these symptoms are coming from asthma.
Yeah, absolutely. Being aware of what these symptoms look like and working with a professional to manage asthma is very important. Managing asthma and avoiding flare-ups during pregnancy is very important. And if your asthma isn't managed or controlled, it can put you and your baby at risk. What are those complications and why is this important to know?
You're absolutely right. We mentioned a little bit earlier that 20% of patients can have exacerbations of asthma. And also in one study, 65% of patients had uncontrolled symptoms. And that can absolutely affect the course of asthma during pregnancy and eventually, unfortunately, could lead to complications for mom and baby. Some maternal complications can include preeclampsia, which is really seen with elevated blood pressures that can lead to end organ damage, preterm labor that can eventually lead to preterm delivery. In the infant, we can see low birth weight, preterm delivery, small for gestational age, intrauterine growth restrictions, all can be complications seen with uncontrolled or severe asthma during pregnancy that potentially could be modifiable.
And there are many steps that patients can take to manage their asthma during pregnancy to help prevent and avoid some of these complications. Can you share some of those tips, Dr. Namazy?
I like to think about it in 5 steps. First is really know what the triggers are for your asthma and avoid them if possible, whether that be smoking exposure, allergies to cats that can make your asthma worse. Also, knowing that you should stay on your medications, and then also being able to monitor your symptoms. And self management is a really important part of managing asthma during pregnancy. Really prioritizing your asthma care, keeping appointments, and following up with your pulmonologist or allergist or obstetrician on a regular basis, who are all interested in how well your asthma is controlled. And also having an asthma action plan, which is very important in self-management.
Yeah, and an asthma action plan includes important information like medicines on it. And a common concern that comes up is, are asthma medicines safe to use during pregnancy? Can you talk more about that?
That is one of the biggest challenges that we have as specialists that take care of pregnant patients with asthma. We know that a fourth of patients actually discontinue their asthma medications when they find out they're pregnant. We also know that we're maybe not doing as great a job as we could be doing, with 65% of patients not even having access to rescue inhalers. But I would like to reassure listeners that the majority of commonly used asthma medicines are safe during pregnancy. And it's important, like any discussion, to look at the benefit and risk. The risk of uncontrolled asthma can lead to maternal low oxygen levels, which then translates to low oxygen levels in the baby, which potentially can lead to complications that I'd mentioned earlier.
The CDC recommends that people get an RSV vaccine between 32 and 36 weeks of pregnancy. What is RSV and what is the benefit of this vaccination?
RSV is a common respiratory virus that can lead to very severe respiratory infections and illnesses in infants, as well as elderly patients and those patients with immunodeficiencies. But RSV has been shown to be the leading cause of bronchiolitis or inflammation of the airways during infancy. And so with RSV vaccination now available and approved for third trimester pregnant patients, we have seen a significant effect on the reduction of respiratory illnesses during infancy, because there is passive immunity where the antibodies can travel across the placenta and protect the baby during those first months of life.
Thank you for sharing that. AAFA and Quad AI worked together to create Breathe for Baby. It aims to educate health professionals, patients, and caregivers about the importance of managing asthma during pregnancy. Tell us more about this collaboration and the Breathe for Baby resources.
Yes, I love the word collaboration, which I think is so important. And it's so important in managing asthma during pregnancy. And that's where the Breathe for Baby platform is very, very helpful, because it helps in the multidisciplinary approach to caring for pregnant patients with asthma. And when I say multidisciplinary, I'm talking about involving obstetrician communication with specialists such as allergists or pulmonologists and family physicians, so that we can all take an effort in adequately managing these patients with asthma. And also it includes self-management tools, empowerment of pregnant patients with asthma to care for themselves and also help communicate. And the Breathe for Baby platform includes an asthma action plan, again, which helps the self-management, but also the dissemination among all of the providers taking care of these patients to know exactly how controlled their asthma is at any point in time during pregnancy. And it also includes a pregnancy ACT, which is asthma control test, again, allowing patients themselves as well as those taking care of them to see how well their asthma is controlled. In addition, it contains a significant amount of educational material looking at the safety of asthma medications, including asthma biologics, which are newer treatments for severe asthma during pregnancy.
You mentioned the Pregnancy and Lactation Asthma Action Plan, which includes information about medicines, recognizing when symptoms get worse, and what to do in an emergency. It also includes asthma zones. For those that aren't familiar with them, can you explain what asthma zones are?
An important part of the asthma action plan is really helping patients self-manage their asthma. And part of that is allowing identifiable areas in the action plan or asthma zones where they can see if they're controlled, which could be a green zone, if they're maybe losing control of their asthma, which may be a yellow zone, or maybe where their asthma is very, much less controlled, a red zone where they should contact their physicians.
And for more information and to download these resources that we're discussing now, visit afa.org/pregnancy. We'll also include them in the description box below. Among our listeners, we have caregivers, patients, and healthcare providers. So I want to take a moment to speak specifically to the healthcare professionals. What are some ways that healthcare and community health professionals can raise awareness of this issue and support pregnant people with asthma?
I think that there is definitely a growing need to pursue precision-based medicine. And that really includes treating each patient as an individual and really identifying what we call treatable traits or factors that can influence and may be barriers to control for each patient, whether that be gestational weight gain or weight gain during pregnancy, smoking cessation, adherence, or education. And these treatable traits can be factors that can influence their control or rate of exacerbations. And if we can identify these treatable traits in each of our patients, we can significantly improve their asthma control and reduction of exacerbations during pregnancy. So I think there's a multi-dimensional approach to treating patients with asthma during pregnancy. And like I had highlighted earlier, there's a multidisciplinary approach as well. And I think knowing that if you can identify access to care or educational materials that may need to be in a certain language for patients, or these other factors outside of asthma is really important as well. But I think it all comes down to education, educating the patient that they really need to take ownership of their condition of having asthma during pregnancy, and that they need to stay on medications. And if they have questions, there are ways to help, and there are educational materials that they can download through the Breathe for Baby platform, or they can call their allergist or pulmonologist or obstetrician. They can look at their asthma action plan and really identify where they are by their asthma zones and if they need help, or what do they do to their medicines based on their asthma zones. There's so much information out there, but I think educating patients is important because we do have a ways to go. Adherence is an issue, and physician under treatment is an issue. And if we can educate our patients and each other, and having these available resources online is critical so that we can really better manage our patients.
Dr. Namazy, thank you for joining us to discuss the importance of managing asthma during pregnancy.
Thank you so much for letting me be part of this.
Of course. We hope you have enjoyed listening to the Afternoon Chats podcast, available on Spotify and YouTube. Don't miss our future episodes, and remember to like and subscribe to our channels. The information presented in our podcast is educational and not intended to provide individual medical advice. Please talk with your healthcare provider for advice about your personal health. If you have questions about asthma or just need someone to talk to, our Asthma and Allergy Foundation of America online community is always open. You can find it at aaflikeFrankA.org/join. We also provide support via the Black Women with Asthma Alliance to support better asthma health for Black women during all stages of life, including childhood, adulthood, pregnancy, and menopause. You can join this group at aaflikeFrankA.org/join, BWAA. Before we say goodbye, we'd like to thank Quad AI for their collaboration with us on the Breathe for Baby program, and thank you to the CDC for their support of AFA's asthma programs. Have a good afternoon, everyone.